We're going to talk about the difference between visual therapy and visual processing. Some people think they're one and the same, very interrelated and probably have some overlap. But visual therapy is really to correct something that is functionally not working in the eye. If you broke your arm and you go to physical therapy for your arm to strengthen the muscles and get that full range of motion, you're doing the same thing for your eyes. So it's typically the two eyes aren't working together correctly. Perhaps you're only using one eye for monovision. Perhaps you're using both eyes and they're not combining what you're seeing so that you have two different views of something. Or perhaps one eye is not tracking along with the other eye. These all have different capabilities and different names to them. But if your eyes aren't functioning correctly, then you need visual therapy. If your eyes are functioning just fine, but you have struggled with visual tracking, that's a whole other thing. So visual processing is a group of skills that we need to learn. Number one thing you need is to be able to track visually. So when you're reading left to right. If you're taking a test, you need to be able to track which line you're on. That ability to visually track is a really important skill and can be practiced using things like word finds and other fun games of that nature. The other aspect of visual processing is that visual spatial. Can you envision a puzzle piece, whether or not it would fit into a puzzle, without actually picking it up and putting it into the puzzle? Can you see if it's the right shape? The idea with visual processing is to be able to envision those things without actually picking it up and seeing if it fits in. One great game to actually develop that visual processing, the visual spatial, is to work with tangrams. So you might have a shape or a picture that's developed with tangrams and taking those shapes, those plastic shapes, and see if you can recreate that puzzle. And the last area of visual processing that we talk about is that ability to envision. So if you're reading a story, can you create a vivid image of what you've just read? And one of the reasons why most often when we go to see a movie that's based on a book is that we have different views of whether or not that movie was exactly like the book or not, is because I have a different movie in my head than you have. But what we know is that for some kids that struggle with reading comprehension, they have no movie in their head. And that's what you want to practice doing, is helping them to create those vivid images. What that requires is just that ability to take an object that you don't actually see and having them create a vivid image through description so that you have the same image in your head as they have in theirs. Training visual processing is really different than visual therapy. There is overlap between the two, but they are two very different categories of skills.